Yeah, so PAs literally practice medicine, and we work in every single specialty and setting. So, meaning we work in hospitals, clinics, all different settings. And we practice medicine, we prescribe medications, we interpret labs. We're doing everything your physician does.
Welcome to That's Term Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Term Good. Today, my guest is Raquelle Akavan. She is the creator of PA Moms. Welcome, Raquelle. Thank you for joining me.
It is such an honor to be here. Super excited since I spoke to you at one of the conferences I met you at.
Yes. So that was diversity in dermatology, right?
hmm
So much fun. So you live in Austin, which is not too far from San Antonio. You've been busy. You won Texas Mother of the Year. That is amazing. Congrats.
Yeah, thank you so much. A organization called American Mothers. The Roosevelts were part of their organization. Like that's how like old it is.
Wow.
Uh-huh. Yeah.
So you've been very passionate about empowering physician assistants and just moms in general. First of all, how did you even get into the healthcare space in general? And then I'd love to hear like why has become such a passion of yours.
Yeah. So when I was like a little girl, I had surgery multiple times. I actually had surgery on my ovaries multiple times. I all of a sudden had like abdominal pain. I was vomiting. They didn't know why, and it took like several weeks for them to figure it out. And then they told my parents that I had cancer, and it was actually incorrect. So they did like an exploratory laparotomy because they were like not sure what was happening. They didn't like have like good technology then, like they were doing ultrasounds and stuff, and so they didn't see anything except for something weird in my uterus. And so after they did the exploratory laparotomy, they found an ovarian torsion. So when I was 4, I had an ovarian torsion, and then when I was 9, I had another surgery on my other ovary. I had a cyst on that ovary. They said that it was super unlikely that anything would happen again to my other ovary. But of course it did. But they took that cyst out at 9. So I had several surgeries. I was in and out of the hospital between 4 and 9 years old. And I think that experience kind of got me interested in helping people, being in the hospital, just wanting to help people. And then when I got to college, that's when I realized I love helping people just in general. And I also love like being around people too. And so just getting that satisfaction. And so I became an EMT in college and was helping people through doing that. And I really loved it. And I was deciding between a nurse practitioner and a PA, and I ended up doing PA because it was a more direct route from my standpoint, at least. And so I went to Pace University, Lenox Hill Hospital in Manhattan, and got my PA degree. And after that, fast forward 13 years later, I just got my doctorate from University of Lynchburg. Super excited.
Congrats.
The reason why I just really, really love helping the group of PA moms and just moms in general is I went through my own personal journey. I had a stroke 4 years ago, and so this huge event happened in my life in the middle of my career. I was 10 years into my career and this happened, and it kind of gave me a new perspective on life. And I really, really wanted to hone in on that passion that I have of helping people. And obviously, at the time, I wasn't able to help people through my job. I wasn't doing surgery anymore. And so we kind of took the group from just being a Facebook group, which was amazing and it's still helping people, to being a real organization where we can actually have a bigger impact. And so my experience going through the stroke, recovering, having women in the group actually helped made the passion even bigger. So I just been, doing that ever since. So
Wow. That is amazing. Having that support, I think, is so important and being able to rely on people that maybe have gone through something like that, but navigating that as a mom too. We were just talking about school projects that that they've forgotten at home, and all the things that we do, and having that support as a mom in general is so needed.
And especially when you're working full time in medicine, obviously we have our own issues just at work, but then at home we have separate ones, right? And then the blends of everything together, it makes it really hard to balance everything, balance taking care of yourself, taking care of your relationships, right? With your
Mhm.
children, your husband, while still being able to do your job in the most effective way possible because we're taking care of patients. So that's the most important thing ever. But you still have to take care of yourself too. Otherwise, you can't take care of your patients. Yeah, so that's what I'm trying to hone in on a lot is, trying to make people understand how to take care of themselves, but also understand what is most important to them. Because once they understand what's most important to them, like their values, then they'll be able to use their values kind of as a compass to make these decisions on like what they should be doing next. Because sometimes when we make decisions on like where to work, we use money and other things to guide us. And sometimes that doesn't align with our values, right? So we shouldn't
Mhm.
be using that as the only decision factor when our values may be, something else, maybe like connection with people. It may be spending time with our family. It may, you know what I mean? It may be like,
Mhm.
can I make a really big impact here? Those things weigh more than making money, and then you'll be happier in general. And then you may end up staying at that job longer.
Yeah.
So
Yeah, that makes a huge difference. So, what are some of the challenges that you've seen with some of the moms, just like as a recurring theme?
I see a recurring theme where people are asking, how do I get out of medicine? Which is
Mhm.
really sad. I hate seeing those posts, but they're there
Yeah.
because they feel burnt out. They're like, I just can't do it
Mhm.
anymore. So they're looking for other things, basically, like other either side hustles or just other ways to make money so that they can get out. So that's something that I'm seeing a lot. I mean, I see a ton of people saying they're burnt out in general, a lot of people saying they don't have institutional support, like they don't have support at their job, like they're seeing just as many patients as the physicians are seeing, but don't have the same support, like having a scribe, having a medical assistant, all of that. I think that PAs and NPs need to look to their managers and push for the same benefits that their physician colleagues have because we're expected to see the same amount of patients and we're doing the same thing essentially, right?
Yeah. So, what are some things that you guys do within your group to help educate companies to help them understand why there is such a need for this?
So I do get reached out by some reporters and like Medscape and LinkedIn, and I've been doing a lot of like advocacy through that. I haven't had any other opportunities to do anything, but we're really excited in the future to get some, public recognition where we can actually speak to, outlets and tell them like this is an issue. I don't think that they realize that PAs are having these problems too. I don't even think a lot of people know what PAs do, honestly.
Do you want to share that?
Yeah, so PAs literally practice medicine, and we work in every single specialty and setting. So, meaning we work in hospitals, clinics, all different settings. And we practice medicine, we prescribe medications, we interpret labs. We're doing everything your physician does, essentially. And we just collaborate as part of the healthcare team. So, whether that's the nurse practitioner, the physician. So we're really collaborative type of profession where we really value that. Especially in derm, I know there's a lot of derm people probably listening. In derm, we're seeing the same amount of patients as a physician. You just may not see us working independently doing like surgeries. We do excisions and stuff like that independently, but major surgery like neurosurgery, you're not gonna see a PA doing that type of thing independently.
I feel like sometimes when you say PA and, you know, patients are like, "What? What is that?" Like I hear nurse practitioner and everybody knows of a nurse practitioner, but
Yeah, so we've
Why
been
is
around.
that not well known?
Yeah, we've been around since 1967. And when we were created, it was medics that were in the army that were basically practicing medicine in the army. And they realized they're pretty tr well trained. Let's tr get them up and trained a little bit more and start doing this. And back in 1967 and in the 70s, we were like a brand new profession and they had no idea if this experiment was going to work, right? Now, skip over to 2024. I'm really bad at math. I don't even know how many years it's been. The experiment worked. We are practicing medicine. We've been doing it for several years, and we're doing it really well. We're experts in the fields that we're working in, and it's really awesome. I think the difference between us and nurse practitioners is there's only about 100 and maybe 80,000 PAs, and there's probably almost 700,000 nurse practitioners. The reason why
Wow.
there's so many more nurse practitioners is because they come from nurses, and the nursing profession has been around for so much longer than the PA profession has.
Mhm.
And so that's why there's so many more of them than us. PAs have a very standardized education. We go by the medical model, so it's a little different than the nurse practitioner that goes by the nursing model. And it's very standardized. So if you get a PA from a school in New York versus a school in Texas, you're going to be taught the same exact thing.
Mhm.
So every single school does the same exact curriculum and the same exact thing. So that's what's really nice about PAs. We get taught with the medical model and we get taught all the same. But there's only like 220 maybe at this point schools. So we're not churning out as many PAs as other professions are. So,
Yeah.
mhm.
Do you think that there are a lot of nurse practitioners that are switching over?
I
Yeah.
don't think there would be any reason for a nurse practitioner to switch to be a PA because nurse
Okay.
practitioners actually have independent practice in
Mhm.
27 states, and we only have independent practice in like 8 states.
Oh, okay.
Yeah, so depending on what state they're in, they have more autonomy.
Mhm.
And we're working on it, of course. I think that they just have a lot more lobby power being in the nursing profession. We're just very underrepresented and a minority in medicine, honestly. So it's been a big challenge, but nurse practitioners and PAs do the same job where colleagues, just like our physician colleagues as well. So we're all colleagues. We're all helping our patients and
Mhm.
depending, obviously we're doing in different specialties, we're doing different jobs, but if I work with a nurse practitioner and a physician in primary care, we're all doing the same exact job.
Mhm. Yeah. So I met you at the Diversity and Dermatology Conference. Are you in dermatology at all?
I started in plastic surgery and then most of my career worked in neurosurgery. And then I did a little bit of like orthopedics and spine as well. After my stroke, like I told you about that a little
Mhm.
while ago, I took a year off to recover and then I went into academia and I started as a professor at South University Austin and developed the program there. And I was there for 3 years. And I just recently transitioned as faculty at University of Lynchburg, Doctor of Medical Science program. And I just finished up training for aesthetic medicine. So I'm going to be going back to clinical work, which is awesome. Doing aesthetic medicine. So I'll be doing injectables, Botox, neurotoxins, fillers, skincare, and everything like that. So
That's exciting. So you love the educational aspect. When did you decide you wanted to work at a university?
So after my stroke and after, thinking, I'm like, I'm kind of ready to go back and start working again. I
Mhm.
was thinking about like what my biggest passions are and what my biggest values are. And I really wanted to give back to the PA profession in another way. And I felt that going back into academia and teaching students was going to really help me do that and be able to help the PA profession, really shape students' minds and stuff like that. So that's why I wanted to develop the program in Austin. Also, it was like a really big challenge, and I really love big challenges. And now it's 3 years later, and they're fully up and running. They're on their third cohort. So, like, super proud of them.
That is really exciting. So now, as far as PA moms, how much has that grown and what are your plans for the future?
Yeah, so it's grown so much. Just in the last couple of years, we've like doubled in size. We're almost 20,000 members. Some people still don't even know who we are, of course, but I'm trying to spread the word. But the really nice thing about the group is it's free membership, so it's really accessible to all, which is great. And we have really great benefits. We have scholarships to the Doctor of Medical Science program. So if you're a PA, you could get basically like a discount on your Doctor of Medical Science degree. And then we also give scholarships to PA students as well, so the master's level students. That's really awesome. And then the biggest thing that we started doing was last year we had our first conference and it was in Destin, Florida. And this year we're doing it in San Antonio in the Hill Country area. And it's going to be amazing. It's called the PA Moms Women's Medical Summit. So that's going to be March 28th and 29th of 2025.
Wow. Well, that's exciting. Was that what you were talking about at the conference, or did you have a discussion or talk when you were there?
I had a talk when I was there, but we spoke about more women empowerment and just like our stories. It was really cool. It was a panel discussion, and I met some really amazing women there. So,
Yeah, that is so cool. I love that you are just empowering women and really helping with advancing their education. So there's all different specialties in the group then.
yes, 20,000 PAs from all over the country. And it's just really special. I want to tell you a story about the hurricane. Everybody is wanting to help each other with the hurricane. Some of the PA moms like couldn't find their like colleagues and friends. And there's one woman in the group before the hurricane, she offered to have people stay at her house that like were not doing well in Florida, but then the hurricane moved up to where she is in North
Mhm.
Carolina. And after that post, like she was gone. And people in the group were like, "Oh my God, like where is she? We can't find her." No one had her phone number. And then they alerted me about it. And we all teamed up and we literally like had a search party looking for this member. And we ended up finding her, but it's just pretty amazing, like, because she lives alone, I think. And so we were really worried and we wanted to make sure that she was okay because her area was flooded. And so it's pretty beautiful, the amount of people who care about each other there. And most of us have never met in person. So I've never met this woman in person that we were looking for. But we have this connection through our group that is like so, so strong that people care so, so much about each other through, donating clothes to each other, people who have lost their homes, obviously. But this happens a lot more than during hurricanes. Like people lose their homes to fires and they
Mm.
have kids with cancer or they have cancer themselves. And so we donate to each other. So they're like small little funds that we do. I'm telling you, PA Moms moves mountains. Like just
Yeah.
just that group, those people, they're so, so amazing, the people there and what they can do. So even more than just helping the
Yeah.
patients, right? Like they help patients every day and they're like superheroes every day, but then what they do outside of that is so beautiful. It's amazing.
That's exciting. I love that. There's such a need for that kind of organization where you can know who to reach out to when you have questions, whether it's work related or just family related or just anything, in general. I love that there's a community there. So if anybody is listening that is not a member of PA Moms, how can they join and how can they find out more information and what all of you guys are doing?
Yeah, so if you're a PA, you can join our Facebook group. So just go on Facebook and search PA moms or physician associate moms and answer the questions, and we'll let you in. If you're not a PA and you're an NP or a physician, you can follow us on Instagram. Our handle is PA_moms. If you want, you can also follow us through our website, which is www.pamoms.com. And we also have like a LinkedIn, we have an X account, but I don't really use it a lot. We also encourage NPs to come to our conference too. So PAs and NPs can get CME credit from our conference. There's going to be 32 category one credits. So it's going to be awesome. It's all women. Your family can come and enjoy all the amenities at the resort, but obviously, they're not going to be getting CME, but it's going to be so amazing. And so I invite all of you to come, obviously.
Yeah.
So.
What are some of the topics for the next conference?
Oh
Do
my
you have
God,
any?
there's so many good ones. So we have some like leadership topics. We have primary care, ENT. We have one on a really cool one on like women's health, but it's more about like bloat. So like it's to like detect cancer. So it's like
Mm,
about bloating and like what that means if your patient comes in with bloating, that complaint and what the differentials could be. I think it's a really important talk, but it's also really relevant to women. So it's relevant to us, but also relevant to our patients, which is awesome. So a lot of the talks are like that. So we have like really cool ones about children too, like pediatric topics. So if you want to learn more about the conference, you can go to our website, pamoms.com, and it's on our homepage, the conference, and there's like a schedule there and everything. So, and we
that's
still have an
cool.
early bird discount right now. So it's a
Okay.
perfect time to sign up.
Yes. I love conferences. There's just so many good things that you can learn. It's always fun to hear new topics and just learn new things.
So our keynote speaker is Lady Spine Doc, Betsy Grunt. She's a very, very well-known and pretty famous neurosurgeon from Georgia. She's an amazing leader, a female neurosurgeon. So like that is obviously pretty rare, but she is such an advocate for PA and NPE profession also, and a really just amazing leader to learn from. So we're going to learn from her. We're going to learn how to do like work-life balance from her. So it'll just be
Mhm.
really great to meet her and hear from her. So if you want to meet her or and you want to see her
Yeah,
live, come to my conference. It's going to be awesome to the PA Moms
that's
Conference.
exciting. That
Yeah.
is so exciting. So I also heard that you are on an advisory member for Fabletics.
Yeah.
How did that even come about?
They reached out to me, I think last year or 2 years ago. I don't remember exactly when, to do it. They wanted to find the leader of PA moms and they wanted more people to advise them on the scrubs and everything like that. So we meet once a quarter and they tell us about like what they're going to be doing. They want advice from us from all different healthcare workers. So there's PAs, nurse practitioners, nurses, there's all kinds of physicians
Mhm.
that we meet all together with the Fabletics team, like their marketing team, the team that does like that actually makes the clothes there. And they want to hear from us and like what's important to us and everything like that. So it's good to have PA representation there because obviously we are a minority in medicine and some of them don't even know what we do. So it's really important. And I love working with them. It's really awesome.
Yeah, it is good to get that awareness out there and let people know, what it is that you do and, how you're able to really help patients as well.
Mhm.
Yeah.
They care about who they're making these scrubs for. You know what I mean? Like that,
Right.
right? Yeah. So.
Yeah. I know it's like so important. So, had mentioned before that you do a lot of traveling. What are some things that you are doing just to relax and unwind and just take time for yourself?
Yeah, so well, I've been doing a lot of traveling for work, but I also recently did some for fun too. So traveling is actually one of like the things that I love to do
Mhm.
to relax. But I went to Disney and that is not a relaxing trip. So everyone who's listening, I mean,
Yeah.
you probably already know this, but that's not a relaxing trip, but it needed to be done. It was an amazing trip and an amazing experience that created beautiful memories with my family. The other things I really love to do is just be outside, either sitting by the pool. I live in Austin, so it's pretty warm all year round. So we like to
Mhm.
do hiking. There's a lot of hiking around my house. But that's like honestly like my favorite thing to do. Hmm.
That's awesome. I love it. Well, thank you so much for joining me, Raquel. It's been such a pleasure talking to you and getting some really good insight on PA moms, but PAs in general, what they do. I appreciate everything that you do, and what you've created is so amazing and so empowering for moms, especially. So,
Yeah, thank you so much. I really appreciate it. And I'm really excited.
thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.